Hello and welcome to the lecture on Chapter 11. Wow, it's hard to believe the course is almost done. And when you think about it, time flies when you're having fun, doesn't it? Well, all right, at least I hope so. All right, so in this chapter, we're going to be looking at public health. We're also going to be continuing to examine government's role within healthcare. Now, like we've done with some of the other concepts, we're going to be looking at the history of how this public health movement started. We're also going to be looking at what shaped it and how we're assessing it and utilizing it today. Now, as always, with the other chapters and kind of the whole theme throughout the course, we've got this thing called the Affordable Care Act, and we're also going to look at its implications to these areas as well. All right, so with that, let's go ahead and get started with our exploration into public health. This week's word cloud contains terms that are important to this week's topic. As always, Google them to gather different points of view and read them in the chapter and see them in their context. There are two standout terms: ecological models and policy development. These should be new to you. If you were to pick one, either one, send me an email and tell me if you have or have not heard of it and what it means. I'll add 5 bonus points to your course grade. Many of you don't need the extra points, but if you think that you might be a little bit on the margin between 2 different grades for your overall course grade, might as well send me the answer to that question, and you'll add 5 more points to your total. Let's look at public health. What exactly is it? Well, public health refers to the efforts made by communities to cope with health problems that arise when people live in groups. You all know what it's like to live and share a communal space, whether it's at work, whether it's at school, or even at home. These are places where we share everything, and I mean everything. And it is the mission of public health to look into these communities, identify health problems in them, and to come up with solutions to them. Sometimes this means setting public policies through government agencies. Now, one of the terms in the word cloud this week I asked you to pay kind of particular attention to was the ecological model. The model identifies causes of public health problems rooted in the physical and/or social environment and behavior related to the individual. The ecological model takes into account the vast number of determinants that impact the health status of groups of people and facilitate decisions about the most expedient path to developing effective interventions. Now, some of the determinants used include physical environments where people live and work, political conditions under which people live, human biology and genetics is another one, social factors would be in there as well, behavioral choices, and lastly is cultural norms. All of these factors impact population health. Finding causes and solutions using these models and factors is the way public health functions. Okay, time to go back in history a little bit. The first settlers that came to America were majority from England, and theirs was the knowledge base on which the United States built our public policies on public health. Like England, the United States developed poor law policy, and that's actually in quotes, poor law. The poor laws provided that any town or city could establish an almshouse. It did not take long until almost every community had an almshouse. Now, these were far from the houses of healing that some thought. Classically, the conditions were dangerous, and the outcomes were not very good if you were put into one of these almhouses. Yet they remained a mainstay of public health options for several centuries. To show you the impact of public health announcements have changed, consider the 1865 announcement from the New York City Council of Hygiene and Public Health addressing unsanitary conditions in the city. Within a year of the announcement, the city passed a public health law that created the City Board of Health And this provided to be a turning point for public health in whole. Actually, it set the stage for public health within the United States. In 1889, Congress established the Public Health Commission Corps. At the onset, the vision was for this to be kind of like a mobile corps of physicians to help the nation in fighting disease and protecting health. But it took a different path and became an aid for the military, giving physicians military rank and pay. It also binded them to the Army and Navy duties whenever they were assigned. In 1891, Staten Island Marine Hospital was moved to Washington, D.C., where in 1902, a new law changed the name to Public Health and Marine Hospital. Again, there was an evolution of the name. In 1912, the U.S. Public Health Service, and ultimately became an agency in the U.S. Department of the U.S. Department of Health and Human Services. And the Department of Health and Human Services is now responsible for the largest public health program in the world. Let's take a look at one of the largest departments within the United States government, and that is the Department of Health and Human Services. It plays an important part in the health experience in the United States. Now, your book says the 2013 budget for the DHHS was around almost $1 trillion. I believe it was $941 billion. The proposed budget for the subsequent year was over $1 trillion. The Department of Health and Human Services is a federal government's principal service to those vulnerable populations. The agency is really concerned with the health and the protection, the promotion, the provision of health and other human services, again, to those really vulnerable populations, that may be being especially the elderly, for example. It's also the largest grant-making agency funding research programs. A little bit about their research funding. The department has lately only been funding research initiatives they solicit. So if you have some wonderful question on healthcare and you need some money to do some research, don't rely on any funding from the Department of Health and Human Services. In other words, don't knock on their door. They're going to knock on your door if they feel that you are pursuing a line of inquiry that they are interested in. Now, the department oversees the administration of the two biggies, that's Medicare and Medicaid programs. Also, the department includes over 300 programs in some of the following divisions. We have the National Institutes of Health, the Food and Drug Administration, the Center of Disease Control, Indian Health Services, Health Resource and Service Administration, Substance Abuse and Mental Health Services Administration, the Agency for Healthcare Research and Quality. We also have the Centers for, the big one, the really big one, the Centers for Medicare and Medicaid Services and Medical Services, I'm sorry. And then we also have another rather large one, Administration for Children and Families. And another behemoth is the Administration on Aging. So if you look at that, and those are just a few of those 300 departments. So the Department of Health and Human Services is actually, when you look at it, is a tremendous size or component of the United States government. The Veterans Health Administration system can track its roots back to all the way back to the Civil War. So many Americans, both on the Union and Confederate side, were disabled and injured in the most bloody war in the United States that we've ever had. And there needed to be some sort of government accounting for the human costs especially for the defense of the Union. Over time, the VA has grown to be one of the world's largest health systems, serving the military with medical care and rehabilitation services, as well as research into new technologies to aid in getting the wounded back up on their feet. Due to the type of care it delivers, the VA is in a unique position of having patients from enlistment to basically to the grave. So once you enter the armed services, you can carry that those services depending on your level of service to the country, but you may have those all throughout your entire lifetime. And documenting all of that through their lifetime of their entire medical record. Access to these records is system-wide, so once you're in there, they can access all across. So when you're a VA patient who lives in Wisconsin and you're treated on vacation, let's say in South Carolina, the VA in South Carolina has instant access to the entire medical record that you have. This allows for a continuous quality of care without overlapping services, creating cost-saving environment along with a reduction in medical errors is the hope. Now for HIT students, health information technology professionals, and students that may be in this class, in this course, know the value of such a record throughout through their study as they've been looking at the application of the electronic health record. Through the Department of Defense Military Health Services Program, the federal government provides both direct and indirect healthcare services for military personnel and their dependents and military retirees and their families and others entitled to the Department of Defense benefits. There are nationwide, you have care clinics that are designed to deliver these health services for the active duty as well as to support for their families through TRICARE, if you've heard of that. The federal government is not the sole funder for military health benefits. Also, state and local governments have funded programs that contribute to about 14% of the total healthcare expenditures here. Over the years, public health services have contributed to increasing our lifespans, improving the quality of our lives, and have decreased mortality rates when it comes to disease and injury prevention. Still, the competition for the dollars necessary to achieve and maintain these goals is somewhat fierce. Some of the issues can be traced back to individual incentivized programs that failed to improve health standards. As demonstrated back in the 1960s. By 1968, federal health policy changed, shifting important new programs to other agencies, leaving public health services kind of out of the loop, but not entirely forgotten. The Nixon administration, for those of us that are old enough to remember the Nixon administration, proposed a redo of the public health service by repackaging it and sending it off to the states for administration, effectively taking the federal government out of the funding equation. This new federalism was not entirely successful in the Nixon-Ford years. Ford was the president who succeeded Nixon after he resigned, but it was revived during the Reagan administration in the 1980s. This was the beginning of the end for federal public health services. By 1998, the near-dead public health service was getting a second breath. A special committee delivered a report on the status of public health in the United States, concluding that it was in trouble. It linked poor image and the public's lack of knowledge of what public health is and should be meant to them. And the main culprit in this situation was really a lack of a sound public health policy. The lack of a consistent government response to the AIDS epidemic, especially, health agencies and politics, and a lack of clear delineations between the levels of government within public health were named as contributing factors for its ineffectiveness at the time. Unfortunately, the strategies developed after the report was published never really materialized due to lack of funding. It wasn't until about 2 years later that the Department of Health and Human Services published their own report called Public Health Service, Healthy People 2000, National Health Promotion and Disease Prevention Objectives. Pretty long title there. But I'm sure some of you know this better as kind of the short term, as we call it. The shorter name is Healthy People 2000. This report represents the Department of Health and Human Services plan for fixing public health in the United States. In this report, one of the objectives called for a 90% of the population to be served by local health departments that would effectively carry out 3 core public health functions. And those 3 core functions are: 1, assessment. That's collecting and analyzing data to define population health status and quantify existing or emerging health problems. The second function was policy development, generating recommendations from the available data to address public health problems. And then lastly was assurance. That's governmental public health agency responsibility to ensure the basic components of healthcare delivery systems are in place. These core functions tie back to the accepted 10 essential health department performance responsibilities of, and we're going to list all 10 of these, so bear with me here. So the first one is to monitor health status to identify and solve community health problems. The second one, again, going back to these 10 essential health department performance responsibilities. The second one is to diagnose and investigate health problems and health hazards in the community. Third one is to inform, educate, and empower people about their health issues. Fourth one is to mobilize community partnerships and action to identify and solve health problems. Next, we have develop policies and plans that support individual and community health efforts. And now we're at number 6, which is to enforce laws and regulations that protect health and ensure safety. Number 7 is link people as needed with personal health services and ensure the provision of health care when otherwise unavailable. Number 8, ensure the provision of a competent public and personal health care workforce. Number 9, evaluate the effectiveness, accessibility, and quality of person and population-based health services. And then lastly, number 10 of these 10 essential Department of Health performance responsibilities, what the Department of Health has to do, what they're saying they want to do, is number 10 is to research for new insights and innovations, innovative solutions to environmental health problems. Now your text has a wonderful chart depicting the links between the core functions and the essentials. Look at the center, you have research. Again, nothing happens without that. The Healthy People Initiative lays out goals every 10 years. So Healthy People 2000 failed to meet 85% of its goals across about 319 objectives. Objectives addressing obesity, marijuana use, exercise, asthma, and diabetes in relation to the health of Americans either stayed the same or actually got worse. This was admitted in the Healthy People 2010 plan. For 2010, the targets were set across 2 broad goals, supporting 467 objectives grouped into 28 focused areas. The 2 broad goals are: 1, to increase the years and quality of a healthy life. That sounds pretty good to me. And 2, to eliminate health disparities. That sounds pretty good to me too. So this is much like going back to its roots, restoring the public health services to its mission on its inception, which is to make lives longer and healthier for everyone, not just for the upper class or high income earners. Now let's talk about Healthy People 2020. It's still looking ahead even further to develop better living and health outcomes. It will include the 2010 objectives along with some additions. So here are some of the additions they're putting in the 2020 plan. Adolescent health. Number 2, blood disorders and blood safety. 3, dementias. 4, early and middle childhood. 5, genomics. 6, global health. 7, health-related quality of life and well-being. Number 8, healthcare-associated infections. That's a biggie. Number 9 is lesbian, gay, bisexual, and transgender health. Number 10, older adults. Number 11, preparedness for disasters. Number 12, sleep health. And number 13, social determinants of health. Healthy People Initiative is a daunting undertaking when you look at everything that they're trying to accomplish. Being able to accomplish all these objectives in 10 years span is a little unrealistic. But it does give focus to the initiatives that are critical to ensuring the quality of the public's health. Finally, a cartoon that is funny and at some times appropriate. Let's take a look at the ethics and public health. Remember the scathing IMO report back in 1988 that pretty much said public health was all but dead? Well, out of that report came another positive light for public health. In 1993, the National Public Health Leadership Institute developed a code of ethics in public health services. This was a necessary protocol to protect the public health's in a moral and responsible way. The code reflects several ethical concepts of human rights, distributive justice for the disenfranchised, and the duty to take ethical actions. There are 12 principles of ethics in public health, and we're going to go through all 12, so sit back. All right, so number 1, we have public health should be addressed principally the fundamental causes of disease and the requirements for health, aiming to prevent adverse health outcomes. Makes sense, right? Number 2, public health should achieve community health in a way that respects the rights of individuals and the community. Number 3, public health policies and programs and priorities should be developed and evaluated through a process that ensures an opportunity for input from community members. 4, public health should advocate and work for the empowerment of the disenfranchised community members, aiming to ensure that basic resources and conditions necessary for health are accessible to all people. 5, public health should seek the information needed to implement effective policies and programs that protect and promote public health. Number 6, public health institutions should provide communities with the information they have that is needed for decisions on policies or programs and should obtain the community's consent for their implementation. Number 7, public health institutions should act in a timely manner on the information they have within the resources and mandate that they are given to them by the public. So the mandate comes from the public. Number 8, public health programs and policies should incorporate a variety of approaches that anticipate and respect diverse values, beliefs, and cultures in their community. Number 9, public health programs and policies should be implemented in a manner that most enhances the physical and social environment. Number 10, public health institutions should protect the confidentiality of information that can bring harm to an individual or community if made public. Exceptions might be justified on the basis and the highly likelihood of a significant harm to individuals or others. So if something, I guess, for the greater good, that can be an exception. Number 11, public health institutions should ensure the professional competence of their employees. And number 12, public health institutions and their employees should engage in collaborations and affiliations in ways that build the public's trust and the institution's effectiveness. In 2002, the American Public Health Association became the first nationally recognized organization to adopt this code. Lastly, I want to take a look at how the Affordable Care Act is impacting public health. It seems as though there are several areas it is indeed impacting. One part of the Affordable Care Act is Title IV. Title IV has to do with the prevention of chronic disease and improving health and the establishment of a National Prevention, Health Promotion, and Public Health Council. This is chaired by the Surgeon General, and its purpose is to lead a national prevention strategy based on programs like Healthy People 2020. The outcome is to improve public health through prevention. Now, doesn't that sound familiar? Several chapters before emphasizing that prevention is cheaper and more effective than treatment and rehabilitation. Ways to accomplish this is by expanding and enhancing programs that promote tobacco-free living, preventing drug and alcohol abuse, healthy eating, injury and violence, and reproductive and sexual health, and mental and emotional well-being. To help, Title IV also created the Prevention and Public Health Fund, a mandatory funding stream dedicated to improving public health. Now, this is the first of its kind. Another part of the Affordable Care Act is Title V. Now, this has to do with the healthcare workforce in improving the delivery of healthcare services for everyone. It acknowledges they need a highly trained workforce of adequate size to deliver the quantity and quality of care needed to touch the entire population of the United States. Because remember, with the Affordable Care Act, additional folks who normally really weren't utilizing those services quite effectively are now going to be entering that stream. So it's really a necessary element to achieve this goal is looking at the current and projected workforce needs and making recommendations to Congress and the federal administration to align federal policies with overall national needs. Title V also offers support in addressing the needs of the underserved with training programs in cultural competencies, prevention, public health, and working with individuals with disabilities. Title V is large and covers many different aspects of fulfilling the need of a workforce capable to handle the health care of an entire population that is also very wide and very diverse as well. Well, I want to thank you for joining me for this presentation on public health. Since I did not explore the entire chapter in this lecture, I only explore bits and pieces of it. Please read what the authors have to say on public health, how it is administered, and its future. I think this is an absolutely fascinating topic. And for those of you that have chosen this topic for their project, I look really forward to hearing what you have to say on public health and what your research has uncovered. So if you have any questions about this chapter or any others, of course, always please ask. I'm here to help. And as always, thank you for watching.